Well, thank you, Larry, or I guess I should say President Atkins. You have waited 30 years of my working with and against you to say that. I know that was one of your bucket list items, so check. Seriously, we do appreciate your leadership, Larry, and really everyone in this room for this evening tonight and the appropriate winner of this esteemed award, Marilyn Moon. I am pinch hitting for Bruce Vladeck due to unfortunate circumstances and the death in the family, and I know, Marilyn, that he wishes he could be here. He loves to be in front of you all anyway and tell you what you should be thinking and doing. But really, as Larry points out, I am just the in-between introducer of the most distinguished guest of honor that we have today, other than our honoree, of course, which is the Secretary of Health and Human Services, Kathleen Sebelius. Sure. She really honors us with her presence tonight, as she has with her service to the nation, which I really have every confidence will continue after she hands over the reins to Sylvia in the upcoming days and weeks. Anyone who knows the Secretary knows that public service is a long-standing legacy of both her and her family. She knows the imperative of continued commitment to social insurance and our health care safety net. This is reflected in her tireless work to implement the law, to strengthen the Medicare Trust Fund, to combat waste, fraud, and abuse, to improve prevention and prescription drug benefits, to constrain cost growth to really historical levels of the Medicare program, and to set the stage for future reforms that will sustain the success that the program has already achieved and is all too often not acknowledged to be currently seeing. Her leadership in quietly working with Republican governors and legislatures, which is no easy task in this environment, to take advantage of extraordinary opportunities with the ACA expansion of the Medicaid program is legendary, at least with people who know and people who will soon know for years to come. She has been steadfast on that, on reducing racial and ethnic disparities, improving treatment for women and children, implementing mental health parity. She has evidenced extraordinary leadership in investing in and providing incentives for all our healthcare providers to use and communicate through a modernized HIT infrastructure system. I think you even had an event today at Datapalooza this morning, Madam Secretary. Truly, her work has been essential and groundbreaking and will stand the test of time. It was almost 50 years ago that her father, Congressman then, Jack Gilligan, the first person I ever worked for, by the way, in politics, cast his vote in favor of the enactment of the Medicare program, a vote that people don't know but contributed to the loss of his re-election bid, but also contributed to saving and improving the lives, health, and security of literally hundreds of millions of Americans. And suffice to say, history certainly served him well. And there is no question in my mind that it will certainly treat one Kathleen G. Sebelius extremely well as well. It has been the cause of her life, as well as it has been the cause of many of us in this room, and we are all the better for it. So on behalf of all of us at NACI, I want to thank you for your service, Kathleen, Secretary Sebelius. We look forward to reading the next chapter of your book that documents your inevitable future contributions to the cause. please join me in welcoming the 21st Secretary of Health and Human Services, someone I am truly proud to call my friend and colleague of over 20 years, Kathleen Sebelius.
Thank you. Thank you, thank you. Thank you. For Marilyn, thank you. Well, thank you all very much for that very kind and warm welcome. It's nice to be back with NACI. I think this is my third time to come to this dinner. I came first as an insurance commissioner from Kansas, and then came back in 2011, and now it's nice to be back again. And I see so many friends and incredible health leaders in this room. It's humbling to be here and realize the institutional knowledge contained in this room and the legacy of social insurance that continues to benefit millions and millions in this country. Chris Jennings has been a friend for over 20 years, and he taught me a lot about healthcare and about Washington and about how to navigate thorny shoals in this town. And I was grateful to him then, and I continue to be grateful now and look forward to continuing to work with him. But when he asked me to come tonight, I said I really can't come for the entire event, but I'd love to come and just join my voice in paying tribute to Marilyn. It is really a privilege to join all of you to honor a woman who's really done transformative work, and not just in her own thinking, but really shared her thinking with thousands of people and taught them how to think about Medicare and our entire healthcare system. I think Marilyn has not only shared a commitment to the issues, but she and I share another common bond. Marilyn is a sunflower sister. She comes out of Kansas. And as many, too many of the more liberal end of Kansans go, she's out of the sunflower state. And, you know, I'm here to tell you, they need you back. She grew up in El Dorado, which is the town where Barack Obama's mother was raised, and in Augusta, Kansas, and Butler County, not too far from Wichita. And one of her first forays into public service was actually working for a Kansas Republican Congressman, Joe Skubitz, who I got to know because my father-in-law, Keith Sebelius, was one of his colleagues. One of her very first reports as an analyst at the Congressional Budget Office was produced in collaboration with Bob Dole, another Kansan. And those were the days when actually Republicans and Democrats worked together on things that they believed in. Bob Dole actually, just a little anecdote, was the person to take me to both the Finance and the Help Committee in the Senate and introduce me, which was very helpful. It was a significant report, Marilyn's first report, because she was actually able to show that the vast majority of senior citizens in this country are low income, and that when they're asked to shoulder too much of the burden of the cost of their care, it actually reduces their cost of care, and that made a difference to a lot of people. And the notion, which is unfortunately radical to some, that policy should actually protect and take into account the most vulnerable among us, has served really as the foundation of much of the work that Marilyn has done during the course of her career. And at AARP and the Urban Institute and everywhere else her career has taken her, her work has served as a convincing and continual reminder of that common theme. Now, many of us remember the debate around the Health Security Act during the Clinton administration. And a lot of you may recall reading one of Marilyn's patient advocate columns for the Washington Post during that time, when she served as a singular voice, calling on policymakers and politicians to consider the very real impact that health policy has on the lives of real American people. They help simplify an impossibly complicated issue, offering clear, concise answers to people who wrote in with questions about the healthcare system, all the while underscoring the need for consumers to be empowered to make informed choices and forcing consumer-friendly insurance reform, something that we're still at today and trying to push forward. Now, her voice, in many ways, helped set the stage for the historic reforms we've been able to achieve over the past few years through the Affordable Care Act. And I can tell you her voice in translating complicated policies is welcomed, and also cutting through the din of what is often a series of misinformation. But her voice also echoed the vision of Lyndon Johnson, who is one of her heroes and one of mine. No longer, Johnson said, will older Americans be denied the healing miracle of modern medicine. No longer will illness crush and destroy the savings that they've so carefully put away over a lifetime so that they might enjoy dignity in their later years. And no longer will young families see their own incomes and their own hopes eaten away. Now, with Marilyn's help and with the help of so many in this room, the promise of President Johnson's vision has now been extended to all Americans. And as LBJ said as he signed Medicare into law, this commitment to ensuring access to care is, quote, not just our tradition or the tradition of the Democratic Party. It is old as the day it was first commanded. Thou shalt open thy hand wide unto thy brother, to the poor, to thy needy in thy land. Now that tradition, which you all continue to honor with this association and work on every day, and that tradition carried on by Marilyn, carried on by all of you, perfectly reflects the objective of the Robert M. Ball Award, to promote public understanding and informed policymaking when it comes to social insurance. So tonight, as we honor Marilyn, I know I speak for many in this room when I say we owe her, all of us owe her, 300 million Americans owe her a great debt of gratitude. Marilyn, it's my great privilege to be here to recognize you and join everyone in this room to celebrate you, to celebrate your career, your many accomplishments, and what I know will be your numerous contributions to come. So thank you, Sunflower Sister. Thanks to all of you for this invitation, and thank you for choosing such a wonderful awardee. Congratulations.